Hello everybody, it's your favorite massage therapist, Luis Ramos, and today I am here with a new friend of mine, so let him introduce himself.
Hi, how are you? Scott Kennedy. I am the owner operator of Light Path to Wellness, where I bring red light therapy as well as a couple other modalities like infrared sauna, vibration plate, all geared towards helping people with chronic type issues, depression, anxiety, as well as autoimmune type issues, to help try to relieve some of their symptoms in a more holistic manner than through the normal pharmaceuticals.
That is awesome. I just got onto the red light table and I feel energized, I feel clarity. I was on the table, and while I was on the table, I was thinking of things, and as the longer I was there, like my mind just started to clear up and I just started to think a little less. And I also have a slight little back problem. Like my lower back bothers me every so often. And I was laying on the table, the warmth and everything was just felt like it was going all over the body, and my lower back actually started to loosen up, and I felt like it was the pain just started to get less and less and less. So that was very cool. But let's tell everyone, what is red light therapy?
So, red light therapy actually started a good 40 years ago. A lot of people don't realize how long it's been out. It was first investigated by NASA. And then from there, they just kept on doing more and more research. So, red light therapy is what we do is we take specific wavelengths that we get from the sun, but we get specific wavelengths that we know have a therapeutic effect on our actual cells. The best analogy, photosynthesis with plants. So plants need sunlight. They take the sunlight in, there's an actual chemical reaction that occurs, and that plant is then able to produce the energy that it needs to grow, to thrive, to be resistant against certain diseases. So that's exactly what we're doing with the body as well. So we take specific either bulbs or in the past more lasers, focus specific energies that we knew through science has that chemical reaction in the cells, and we put that into the body. So we can do that through, like you did, a full bed, if you picture a tanning bed. We can do it through spot treatment where I can focus specific energy on a certain area and get deep penetration. So that way we can get energy into the muscles, into the bone, into the brain, into the hip, into the back, wherever, into the blood, the lymphatics as well. What is actually occurring is the cells, we go back to science, mitochondria. We know that was like the powerhouse of the cell. So it actually absorbs the energy that we give it. It's able to bring more oxygen in, and then it's able to produce more ATP, which is the energy that we need for, thousands of daily functions. It's what we need to live, really. So the problem has been for, decades, we've been dealing with more environmental issues, toxins. We deal with a lot of stress. We deal with poor diet. We deal with a lot of medications and the side effects that come with this. Or nobody's body is at peak performance. We're not getting the sunlight that we should be as well. So what we're actually doing is we're taking the real positive, beneficial sides of sunlight, and we're able to put it in a box or a laser or a bed or an infrared sauna to get those benefits.
Now, can anyone use red light therapy? Does it benefit someone more than others?
Everybody has a different reaction to light. Now, from a scientific standpoint, we're all going to get help from it. Now, certain people that have, deeper issues, they're going to see obviously greater results from it. There's more to gain from it. But we see a lot of professional athletes, Dallas Cowboys, Phoenix Suns, Patriots, UFC fighters, a lot of chiropractors, Olympic teams, the gymnastics, the Nike running team took a bet and shipped it to Brazil for the track people in the last Olympics. So we're seeing really the people that take it right now are the athletes. And they're in about as peak shape as you can get, but they see that this red light can give them that little bit of an extra edge. So they'll use it pre-workout. That increases the oxygen in their blood. If they have more oxygen, they can actually exert themselves further, they can train longer. And then they'll use it afterward to reduce the inflammation, speed up the healing process, so that they don't have to have as much downtime in between training sessions. So for somebody, a peak athlete, something that can give them that 2%, that 3% advantage is huge. Makes a difference. So we see them using it. So that's usually the start. So we've got a lot of more people like me, kind of middle age. We still want to stay active. We still want to stay fit. We're either seeing ourselves plateau, which bugs the hell out of us, or we're dealing with annoying chronic pain, a knee that just keeps on giving us issues, or a shoulder, and so we can't lift as much, we can't work out, and it's bothersome. So that's generally the people that I've got coming in here. I also have people with fibromyalgia. I have people that come in post-concussion that are dealing with a lot of mental issues from that, dealing with people with depression, anxiety as well, because we know we've got inflammation actually going on in the brain. We have lack of oxygen, we have increased premature apoptosis, cell death. So there's a wide range of people that we can help with this.
And I heard that it's actually really good for skin conditions and arthritis.
Yeah.
So can you explain how it helps with
Sure.
skin conditions and arthritis?
And one of the things is, people say, oh, well, light does all these things. Well, it really only does one thing, but it does it really, really well. And that is it gets the cells to kickstart what they should be doing already. All right, so we can kickstart the cells to do what they're supposed to do. Well, then there's a cascade of events that occur with that. It's like having a car, but it just won't quite start up. We just give it that little kick of energy. It starts up. Now it can do all these other functions. So that's what we're really doing with the body. So whether we're talking about acne, or we're talking about hyperpigmentation, or we're talking about inflammation in the knee, or we're talking about a torn muscle. It all is happening in the same manner, where we're affecting the cells. The cells are being kicked into high gear to help heal the body. So for skin, we're increasing collagen, elastin, which can help firm up the tissue. We can use specific light that'll help kill acne-causing bacteria. The same way we're creating a cellular jumpstart. We're doing the same with inflammation, where the cells will start kicking out anti-inflammatory enzymes that'll reduce inflammation, increase the oxygen into that area, speed up the healing, reduce the pain.
You could never do too much red light therapy, right?
There's a wide window of therapeutic effect with light. Now, with anything, you can overdo it. Will it be deleterious? Probably not, but you may not get as much of the benefit. But whether you're generally doing, you can do every single day light therapy. I generally recommend depending on the device, the power, all of those things, I recommend usually about 10 minutes per body area. So if you've got the big bed, well, you can do the whole body in 10 minutes. If you've got a smaller unit, well, then you got to move it around if you got a home use. But so about 10 minutes per body area is good.
Yeah. And what would be the tools that you use for, like, if I just came in and I kind of wanted the experience, what would my experience be?
So what I first do is I start off with local treatment. So I use torches. They're red light torches. So what I can do is I can focus on specific areas, whether it's your lymphatics to get that flow going. If it's certain meridians that can help with putting you in more of a parasympathetic. I find that it's so important to get things flowing first, get that energy to flow, and then what I can do is do larger treatments of the entire body. So that would be the bed, or even using the infrared saunas as well.
So with the infrared saunas, it's just does steam come with it, or is it just like the light?
Good
Like, how does
question.
it work?
So what's special about infrared is, unlike the steam and the dry, which is heating the air and then the air is heating you, what we're actually doing is getting wavelengths of energy that penetrate deep in the body. So it's actually the body that's heating. So we're getting a deeper penetration, a deeper sweat, much greater detoxification going on with the body as well. And we can do it at less temperature. So whether your steam sauna or your heat, you may actually have to have up to 200 degrees, which can just be too much for some people. We can generally do this at 125, 130 degrees, and people are getting a much greater sweat than they would with those higher temperatures.
Awesome.
Yeah.
Okay.
So again, we're just using wavelengths that we already have with the sun, and we're just fine tuning it to fit just what the body needs.
And while I was on the bed, I saw that you had the machine, and you were explaining to me the shake machine, right?
The vibration plate, that's the only non kind of wavelength thing that I've got here. The vibration plate is great for getting the circulation moving. It's good for getting the lymphatics going as well. There's other benefits for osteoporosis. It's actually good for microbiome in the gut. I like to use it prior to the bed, because if I can get the lymphatics moving and get the blood flowing as well, then the bed is going to be able to hit more of those cells.
So that was all very interesting, very helpful. Tell everyone where they can find you.
Okay, so I'm right on Main Street in Fort Lee, New Jersey. You can go to lightpathled.com, and then you can connect with me that way. I do an initial session for just $25, so somebody can come in and try all of these things and see if it's going to be right for them.
Okay, great. Well, thank you for your time.
Thank you. Thank you.
And I will see you guys later.